When recovering from an injury or a medical condition, there is no better place to do so than your own home. Here to tell us about what Home Rehab Express can do for you or a loved one is Marcos Porras, the owner of Home Rehab Express and a physical therapist, along with Joanne Ellis, who is also an owner and patient liaison. Good morning.
Good morning.
I'm so excited to tell Southwest Florida what it is that you guys are doing here, the services that you're able to provide in our area. How do you explain what home health care is?
Home health care is a service offered through insurance companies that are able to provide physical therapy, nursing, occupational therapy into patients' homes who are unable to make it to the doctors.
Which I'd imagine happens a lot. And again, it's so nice to know that this service, this availability is here in Southwest Florida. What kind of patient would need home health care? I would imagine everybody would, but what are kind of the main ones? How do you describe who would need it most?
Post-operatively, for instance, somebody who's recovering from a total knee or a total hip replacement.
Okay.
Once they do their acute care in the hospital, they come home and they still need exercises to be done, as well as wound care for the incision site, where that's where the ancillary services such as a nurse, occupational therapist, physical therapist go out to the patient's home and sometimes even have to adjust a little furniture so that they can get around.
Yeah, when I was going to ask that, what is it that they're actually doing? Let's start with the nurses, because there's a couple people that may be in your home. One is the nurse. So what are the nurses doing when they're inside your home?
The nurse will be the first person in the home that the patient will see. The nurse will come in and do the initial assessment on the patient. He or she will make sure that the nurses, the therapists are able to provide their services, make sure that the patient understands what's happening. They do medicine reconciliation in the home to make sure the meds are being taken correctly, because actually incorrectly taking the meds is something that a patient actually readmits to the hospital for almost more frequently than anything else. So it's a very big deal to have the nurse come in first and make sure that the initial groundwork is laid for the therapist.
Yeah, so, and then once the therapist comes in, what is it that you guys are necessarily doing there?
We just tag on the initial assessment from the hospital, such as the basic protocol for the exercises, which might be everything from ankle pumps, bending of the knee, walking in the home, appropriately making sure that they're not going to be a hazard to themselves while at home.
Wow, again, a lot of different services, a lot of different needs, but again, I can imagine everybody's going to do better when they're in the comfort of their own home. If anybody has any questions more about what it is that you guys are able to provide here in Southwest Florida, what's the best thing for you to do? I know you have a great website.
Yep, we are basically at homerehabexpress.com.
Easy enough. So again, that's kind of square one. We will also put the information on our website. But again, I'm so happy to have you guys kind of be part of the Morning Blend family. So more people can find out about these great services that you are able to provide in their home. So we appreciate it. We look forward to having you guys back.
Thank you.
Thank you.
For more info, you can head to our website, fox4morningblend.com.